Bismillahirrahmanirrahim. Assalamualaikum to our beloved lecturer, Sir Muhammad Hafiz, and me, Tun Muhammad Syafiq Iman bin Tun Abdul Razak, with my friends Ahmad Faris, Abdul Aziz, Ahmad Syarazi, and Muhammad Tasnim, would like to present to you and discuss about ergonomic hazard identification, the impact of ergonomic hazard to safety and health, and measure to reduce the impact of ergonomic hazard to safety and health.
The other ergonomic hazard identification is repetitive strain injury (RSI). RSI is injury to part of musculoskeletal or nervous system. Basically, there are three causes of repetitive strain injury. First is repetitive use, second is vibrations, and third is compression or long periods in a fixed position. There are a few factors of RSI. First is use of keyboards entry devices such as typewriters and computer, which require long periods of repetitive motion in a fixed posture. Extreme temperatures have also been reported as risk factor for RSI. What is impact of ergonomic hazard to safety and health? First is itching, second is tingling and extremity weakness, third is bruising pain, and last is initially presenting with intermittent discomfort and then with a higher degree of frequency. What measure to reduce the impact of ergonomic hazard to safety and health? First is first treatment. In first treatment, we have the RISE treatment. RISE is stand for rest, ice, compression, and elevation. The next measure is early stage treatment. In early stage treatment includes analgesic or painkiller, biofeedback that is process gaining greater awareness, and the last is physical therapy, as known as physiotherapy. The third measure is aggressive intervention including surgery, and the last measure is effective approach. In effective approach is changing of one environment, especially workplace equipment. The other effective approach is trigger point therapy. For example, is Alexander technique.
Okay, next the ergonomic hazard that I identify is lighting. Lighting is very important aspect during learning session. During learning session, we are using laptop for lecture and do assignment, which can lead to eyesore if we did not pay much attention to the lighting. Okay, backlighting is associated with a range of ill health effects, both physical and mental, such as eye strain, fatigue, and also stress and anxiety. Safety and health measure of this ergonomic hazard is create the workplace area with as much natural lighting as possible. Often just 10 minutes of exposure to natural light are enough to trigger the release of endorphins or happy hormones. Okay, thank you.
Hi and Assalamualaikum. My name is Ahmad Faris, and right now I am going to talk about the next point of ergonomic hazard happens during the pandemic. The next ergonomic hazard is poor posture. During the pandemic, the class is still going on, but through online learning classes, students and lecturers have to working at a desk all day long to finish the class until the semester is over. A desk setup that contributes to poor posture will cause back pain and stress. Hours of sitting as well may lead to poor posture. Impact of poor posture is back pain. Back pain is caused by problems with muscles, discs, and back spine. Back pain can lead to lack of sleep and stress. To reduce the back pain, one should do stretching once a while and always sit with a right posture. When you sit using proper posture, your hips should be equal to or slightly higher than your knees. But if the back pain is too serious, then you should seek for healthcare professional. That's all from me. Thank you.
Hello, my name is Ahmad Syarazi bin Ahmad Fazil. So in conclusion, there are three types of risk factor that can we conclude. The first one is lighting, the second one is repetitive motion, and the last one is back injury. This risk factor can give any danger for our musculoskeletal injuries. So we need to prevent this factor from happen to us. That's all from us. Thank you.